Hello everyone, my name is Dominique Alex and I'm with Mary's Place as the Chief Program Officer. I hope you and your families are staying safe and healthy. As all of us are dealing with the current COVID-19 situation and availability of the vaccine has brought in tons of questions in our minds. Should I or shouldn't I get vaccinated? When should I get vaccinated? Which vaccine is safer? And many other questions. So today, I will take all of these questions to a doctor who has worked extensively in the field and will answer our questions. It is my pleasure to welcome and introduce Dr. Vin. He is the Chief Medical Officer at Amazon and is one of the leading voices on lung and respiratory infections and contemporary medicine.
Thank you, Dominique, for having me here today to speak to Mary's Place staff and guests about this very important subject. My name is Dr. Vin Gupta, and I'm a lung doctor by training. I've been at the bedside caring for critically ill COVID patients from the very beginning of this pandemic. And I've been in public health for all of my career, as a researcher, as a military officer, and as a clinician. I'm really excited to be here today to answer your questions about the vaccine. Lots of people are wondering whether or not you can still test positive if you're otherwise healthy and are fully vaccinated. The answer to that is it's really unlikely. Is it possible? It's possible, but it's really, really unlikely. And if that does happen to be you, we know that maybe in 10% of individuals that does happen, even if they're otherwise healthy, they may still test positive. What does that mean? Does that mean the vaccine was ineffective? No, not at all. Because these vaccines are nearly 100% effective at keeping you out of the hospital. And that's all that matters. These vaccines are nearly 100% at keeping people out of the hospital. Yes, it's true that there's still the really rare chance that you might test positive, but that doesn't mean the vaccine wasn't effective. It's still very effective at doing what it should be doing, which is keeping you out of the hospital. Lots of folks are wondering what type of brand of the vaccine should they get, since we're lucky enough to have that choice here in the United States. What I'll say is, all the brands to date, Johnson & Johnson, Pfizer, and Moderna, the currently approved vaccines here in the United States, are nearly equally effective at keeping you out of the hospital. So again, the only thing that matters here is, do the vaccines keep you out of the hospital? And all three currently approved vaccines in the United States do that extremely well. Mild side effects are the most common side effects, and unfortunately, there's nothing you can do to prevent them. About half of us will experience some soreness at the injection site, a low-grade temperature. A lot of us are going to feel tired, and really those are the types of symptoms that you're going to experience. You can, after you get the shot, take Tylenol or Motrin. You can hydrate well, and you can go to bed early. I'd recommend all three of those. But rest assured, those mild symptoms are vastly the most common symptoms you'll experience. They go away quickly, and they go away best with a good night's sleep. There are no specific groups that we've identified that are at higher risk of a vaccine-induced side effect. So if you have high blood pressure or diabetes, if you happen to be pregnant, you're not at increased risk of a vaccine-related side effect. And we have over 300 million fellow Americans who've at least gotten one shot of the vaccine, many of whom have pre-existing conditions or are pregnant. And those studies have shown, because we've looked really closely at the data, that because you have a diagnosis like that or because you may be pregnant, it does not mean you're going to have an increased risk of a vaccine-induced side effect. So rest assured, there is no medical condition that's going to cause the vaccine to have a weird reaction or some type of severe allergic reaction. We just don't have that data. A common question is whether or not your body is at higher risk of getting coronavirus in the days right after receiving the vaccine, that your body's immune system might be lower, that you might actually more easily contract the virus. There's no truth to that. There's no data suggesting that you're at greater risk of getting infected from coronavirus in the many ways in which it's changing, like the Delta variant, because you got the first shot, and in those days right after you get the shot. If anything, your body is immediately producing protective antibodies, so it can protect you from the many ways in which coronavirus is changing. In fact, you're better protected in the days and weeks after you get your vaccine from coronavirus than before you get the shot. And your immune system is getting stronger by the minute after you get the vaccine. It's not getting weaker. There's a lot of attention on the Delta variant right now. It's this new version of coronavirus that frankly is much more dangerous. It's supercharged. We see now from studies that it's killing more people that are unvaccinated, that it's more lethal, it's more transmissible than the original version of the virus that first appeared way back in late 2019. This is in many ways COVID-21. This is in a lot of different ways a more dangerous threat, and we should call it something different. This is COVID-19 on steroids here. This is COVID-21. And what we're noticing is that if you're unvaccinated at this moment, in late June of 2021, you're at 8 times the risk of ending up in the hospital than if you were unvaccinated at this time last year. In just 12 months' time, the risk of ending up in the hospital, regardless of your age, regardless of your medical history, is vastly greater because this virus has changed. And the threat it poses to all of us, but particularly those that are unvaccinated, is much, much higher. We're lucky here in the United States. The current vaccines do protect against severe illness and hospitalization from the Delta variant. Are these vaccines safe and effective in pregnancy or in breastfeeding? The answer is yes. These questions have been asked and studied repeatedly in the first 6 months of 2021. And what we've seen is that if you're pregnant, if you're thinking about getting pregnant, or if you're actively breastfeeding your baby, that you're not at any increased risk of side effects from the vaccine relative to if you're not pregnant or if you're not breastfeeding. You may be wondering why you still need to mask even if you're fully vaccinated at Mary's Place. Mary's Place is home to both medically compromised adults and children less than 12 years of age who do not yet have access to the vaccine. And because you could still potentially, it's a small risk, but you could still potentially transmit the virus to somebody who is not yet vaccinated if you're fully vaccinated. It's a small risk, but it's possible. We're asking that everybody, in an abundance of caution, continue to mask for the welfare of everybody. Are these vaccines safe and effective in children? And who's eligible to receive the vaccines? What age groups? Right now, children 12 years of age and older can receive the vaccine. So 12 to 17 years of age, that age group, they can receive the vaccine. Studies have shown that the vaccines are safe and effective, specifically Pfizer and Moderna. Before long, hopefully in the next 2 months, children 5 years of age and older will be eligible to receive the vaccine. Those studies are being done as we speak, and they're really optimistic that we'll have approvals for those vaccines for those 5 years of age and older before long, before the start of the school year, which is really great news if you're a parent. There is no concerns that these vaccines are in any way harmful or causing increased rates of side effects amongst children of any age. You probably have heard about really rare reports of heart inflammation or myocarditis from some of the vaccines in those individuals that are, say, 16 years of age and older. And it's true that in a very rare instance, younger men especially can develop a mild condition called mild myocarditis, inflammation of the heart. The heart's a big muscle, and it's an inflammation of that heart muscle in a really rare instance. The majority of cases are, as mentioned, mild, so nobody has to go to the hospital or stay at the hospital. There's no treatment that's required. There might be some mild discomfort, but these go away quickly. And let me remind everybody here that coronavirus actually causes severe myocarditis. We don't talk a lot about it, but it actually causes really severe inflammation of the heart and other organs, especially in younger people. So yes, this vaccine can occasionally cause a mild version of this heart inflammatory condition, but it's much more mild than what the virus can cause, and it's very rare. Are there long-term risks to receiving the vaccine? Their answer is no. We've had 300 million Americans receive the vaccine over the last 15 months. People have been receiving this vaccine for 15 months, initially in clinical trials and now at your local drugstore, wherever you want. It's really widely available. And what we've noticed is that no one is reporting a side effect after, say, 3 weeks after receiving the vaccine. If you're still wondering about whether you should get the vaccine, if you have questions, I encourage you to talk to your healthcare provider. They know your medical history better than anybody else, even if you've only seen them once. They know more about your medical history than anybody else would necessarily. Do you need a COVID-19 booster shot? It depends. It depends on your medical history. If you're immunocompromised, and it's a long list of conditions that might render you immunocompromised. As an example, if you've recently had chemotherapy for cancer, if you're on high doses of steroids for a condition like rheumatoid arthritis, it's a long list. I encourage you to speak to your medical provider to figure out if that's you. But if that is you, you are assuredly going to be made available a booster shot sometime in the fall of 2021. For everybody else, it also depends. So if you're fully vaccinated but not immunocompromised, meaning you're otherwise healthy, it depends. We just don't know yet. The chances of ending up in the hospital now if you remain unvaccinated from COVID-19 are 8 times higher than if you were unvaccinated at this point last year. Thank you so much to all of you at Mary's Place, both guests and staff, for taking time out of your busy days to listen to me as we talk about the coronavirus vaccine and some common questions. I hope I have personally answered some of those questions that you might have and helped assuage your concerns. If not, I encourage you to please speak to your medical provider to learn more about the vaccine so that you can make the most informed decision possible about your own health and the health and safety of your loved ones. I want to leave you by saying that this virus continues to change and that remaining unvaccinated now poses an 8 times greater risk of ending up in the hospital than if you were unvaccinated a year ago, when none of us had access to vaccines. This is a virus that continues to change, and it's easy to let our guard down, to feel that the worst is past us. Because let's face it, we're all really tired. We're exhausted with this pandemic. We want to move on. And so please, I encourage you to learn as much as you can about the vaccine, to arm yourself with as much knowledge as possible, as much facts as possible, so you can make an informed decision. But do know that the ways in which this virus continues to change poses a threat to all of us, especially those that remain unvaccinated. Thank you for your time.
Thank you, Dr. Vin, for joining us today and sharing so much information and debunking some of the myths we may have formed and misinformation we may have heard about COVID-19 and vaccination. Listening to you has personally clarified some of the questions I had in my mind, and I'm sure our listeners, colleagues, friends, and family will feel the same way.